Good afternoon. This is Adam Marconi, and I'm the Vice President of Rehabilitation Services with Doctor's Choice Home Care. If you're viewing this video, then you have recently become part of our team, and we're excited to have you. The following conversation is going to talk about some basic customer service principles specific to therapy. The orientation process will talk about some general customer service principles as well, and some of these will be similar. But this was provided to look at some of the past complaints we've had or things we have identified over the years, as well as just some good clinical practice. So let's take a look at this. From a customer service standpoint, when we work with paraprofessionals, make sure that you let the patient know that you work as a team so that they're not surprised when a different person calls them. Patients get very secure with their nurse or therapist, and they have a hard time sometimes with change. But if they know in advance that somebody else may see them, this helps mitigate any concerns. If you follow another therapist, make sure you review the plan of care in advance so you provide the same and are prepared for the type of care you need to provide. If you have some disagreement, though, please make sure that you don't show this in front of the patient. Make sure that you hold this or reserve it to speaking with the clinician directly. With physicians, if you have any type of concerns regarding the plan of care the doctor may have or disagreement, please make sure that you don't voice this in front of the patient. Make sure you call the doctor's office directly and have some discussion there. One example that is often given is talking about leg length discrepancies. Are often discussed in front of patients. This is actually very normal with most hips, and it will recover after several months, but this can cause a lot of angst for the physician and patient. So make sure if you have any concerns that you discuss it directly with the physician's office. Clinical. We're going to make sure that patients have their own TheraBand, so you don't have to reuse it. Make sure you keep it with the patient and leave it with them. Always clean your equipment, whether it's weights or respirator, Swiss ball, what have you, with the wipes that have been provided before and after working with patients. If you're using any type of modality, make sure that you always note the pre and post condition of the skin and the patient's status. This protects you as a clinician to make sure that you left the patient in good standing, but also ensures that we've inspected and assessed the patient's response to the intervention. If you use biofreeze or initiate that with a patient, you must have a doctor's order for that. If the patient has their own biofreeze and they're normally using it, you do not need it. It's only when you're adding something to this patient's care that was not prior to the services rendered. If you're checking out one of our own units of ultrasound or stim, make sure you sign it in and out, and make sure you, upon returning it, you clean the units themselves. Make sure if you have that device and you're not using it, that you return it to the office promptly so others can use it. If you do have your own device, make sure you have those bioelectrically checked every year and a maintenance log for that unit. If surveyors come, they look to see that these units have been taken care of. When your patient's home, you always want to return it to the same state prior to your arrival. So if you move furniture or change things around, just be courteous and make sure you put things back. In documenting your times, always make sure that you don't round to 5 and zeros unless you actually end on 0 or start on 0 or 5 or what have you. Make sure that you put the specific time. It ensures accuracy, but also Medicare considers it fraudulent to round times when you actually weren't at the home at that time. In the home folder, make sure you document in the communication flow sheet that is in the home folder each and every time. It shows for care coordination, but also protects you as a clinician to ensure your presence in that home for that visit. So if there's any questions in that, we can go ahead and pull that document to see that you actually signed in there. Any vital sign parameters that are outside of the doctor-specific values need to be notified to the physician. You can call the doctor's office, leave a message with the agent of the office, and document who you spoke to or how you left that information there. Make sure that you look at the EMR system. When you enter the vital sign that is out of parameters, it will turn red, and that indicates to you that you must make a notification to the doctor's office. As far as evaluations, it would be unusual for an evaluation to be less than 45 minutes. And it would be unusual for a visit to be less than 30 minutes in the home. There's no specific times Medicare has for services rendered, But by the time you set up your equipment and document and work with a patient, it's very normal that regular visits are 45 minutes to 50 to an hour. Evaluations can be an hour to an hour and a half. So make sure that you're documenting and providing the amount of time for the patient. We do perform random audits to ensure our standards are being met. So any visits found outside of that could be subject to payment recovery if you're a contractor, or if we find that these visits did not occur at all. We don't condone any acts of Medicare fraud, and we will report these items or suspicious activities to the OIG. Things could be such as falsifying signatures, submitting visits to the company that did not occur, falsifying travel times, etc. Anything that is considered fraudulent can be investigated and as well as reported to. So please make sure that you don't have any of that information. If you see anything occurring, please let us know so we can also look into that. As a company, we have many employees that we have to pay. We want to make sure everybody works in an environment that is safe and secure and is compliant. If you are aware of a fall that a patient has, make sure that you notify the director immediately, and we fill out a incident report within 24 to 48 hours. Durable medical equipment. The best option for this is to ask the doctor's office to send it directly to the durable medical company. You can provide them the phone number or fax number where they can send this information to, so we don't have to write an order to be a third party to get this device. We are able to write orders if necessary, but it's best if you provide this information to the DME, to the physician for the DMN company, that they can send the order directly to them. Our Medicare week is Sunday through Saturday, so when you're writing your frequencies or durations, you're going to be writing them within that time period. Initial orders will include the evaluation and the frequency, and should be written with the frequency first and duration second. So for an example, twice a week for 3 weeks is listed here. Also include the effective date of when this order will take effect. We do have the carryover function on in WellSky, which is basically a pre-filling from your prior note. So this is meant to reduce any redundancy and also help your notes be able to be completed more timely. But please note, if you are having identical notes and not changing information with regularity, the function will be turned off. We will counsel you and talk to you about this, but please make sure you're using that responsibly. Anytime you go out and see a patient, you must contact the doctor's office for the order. So you can get a verbal order, and it's per Chapter 7 of the Medicare Benefit Policy Manual. You want to document who you spoke to, the time and date. If for some reason you have to leave a voice message, which is very common today, you can leave your contact information with the doctor's office and ask them to return a call to agreeing that they will sign the orders. So the best thing to do is after you see a patient, whether it's later in the day or immediately after seeing a patient, call the doctor's office and use some phrase along the terms of, "This is Adam from Doctor's Choice Home Care. I just saw Mr. Johnson. I want to verify that you'll be signing orders for in this case, physical therapy. We're going to work with the patient on gait and balance training, and we're going to see them twice a week for 3 weeks." Something along those lines would be what you'd want to leave with them. Ask them to return a call to you, and if they don't call back within time frame for you to put it in your evaluation, you can complete your evaluation and use a communication note in the EMR system to write down that they returned your phone call and the date and time they did that, verifying that they would sign the orders. You must keep the patient keep them abreast of their plans of care. This is due to the conditions of participation from Medicare. So you will notice that there is a therapy report. That is something we have specifically designed for therapists that has a statement there that the plan of care was discussed with the patient who's in agreement with the goals and interventions. So you will look at that on another video, but this helps us meet that condition of participation. You can also put that statement in your evaluation at the end of your assessment. Medicare requires a reassessment at least every 30 days. So we will often schedule it slightly in advance around day 21 to 22, 22 to 25. So this makes sure that we're not going to miss the 30-day reassessment. Therapy assistant supervised visits will occur at least once during the 60-day period. And often if the therapist is coming to do a reevaluation, we will just go ahead and assign it at the reevaluation time frame. And if there's no reevaluation due within the time frame of seeing the patient, then they may put a supervisory note on the discharge for the therapist. And all goals must be written in functional, measurable, and specific to the patient. Working with the branch, after the evaluations, report to the office the plan of care, how often you're going to see the patient, and what you're thinking. This helps with care coordination, and particularly when we have multiple disciplines in speech, OT, and PT, that we must coordinate our care to make sure that the services we're going to render are going to fit within the functional score based on the OASIS and the information we have. So make sure that you always care coordinate together when you have multiple disciplines. Always put your notes in a saved status. This provides evidence from the office to look at the EMR system to see that the patient was actually seen. So that's a very easy way for us to identify this without having to call you. If you don't put it in save status, we will call you and ask, did you see this patient? If you couldn't see the patient, you also have to let us know so we can move that visit or change that visit to a different date. Always do the visit on the correct date. You have the ability to change the visit date in the MR system, but make sure you move it from Monday, for example, to Tuesday. If you couldn't see them on Monday, we're going to see them on Tuesday. The system will let you complete a note on Monday, even if you did it on Tuesday. So you have to manually change the date to make sure we're not going to have a deviation there. Always keep in close contact with the office regarding any projected time off. This needs to be well in advance. This way we can look at securing enough coverage to cover those visits. And lastly, report missed visits to the office. If you need assistance to make up these visits, then certainly let the office know. It is the expectation that you will finish your plans of care, that you will not have missed visits. If you do have missed visits, then we can see the patient at the end of the plan of care, or if you wrote an order to make it up or add a visit to another week, we could do that. But the expectation is that we will continue to see the patients based on the plan of care we projected there. So that's the last of the fine points here of the therapy expectations. You'll have a copy of this that you can refer to, and if you have any questions, you can talk to your director at your office or give me a call. Thank you very much.